Trauma. At any given time in our lives, we can experience a crisis. So what does this mean, and where do we go? I want to throw some numbers at you to remember. Texas ranks 48 out of 50 states in mental health services. This is according to Forbes. On top of that, 41% of adults don't seek mental health services because they can't afford it. In addition, Texas ranks 5th in the lowest of treatment centers. Simply put, even if you have resources, there's not enough avenues to seek help. Texas also has the 4th highest percentage in children that are covered under private insurance companies that typically don't cover mental health services. So why am I talking about this? We need to resolve to do better. We have to put the mental health conversation to the forefront, and we have to include our community members, our businesses, our nonprofits, our legislators, and most importantly, our health insurance companies. We need more facilities, more counselors, and even more therapy animals. It doesn't happen overnight. It doesn't happen all at once. It can happen on a small scale. Like Texas State University, where our counseling center has implemented an after-hours mental health assessment program. The university's president rolled out with timely care application for our students. And the university police department has their full-time mental health officer, and shortly after, we added my best friend, Officer Brady. He's the first active therapy animal on a college campus in the state of Texas. Other universities have therapy dogs. I would equate them to being a facility dog, as they don't necessarily leave their designated departments, where Brady does. In the year and a half that Brady and I have been on campus, we have visited and gone on calls, both on and off campus. We've been to residence halls, classrooms, basketball camps, autism camps, vigils, and so much more. So much so that we've even paired up with our local school district to start visiting our primary and secondary schools in this area. We've done so much, and we've seen so much. I've seen how one animal can impact our university and our area. He's opened the conversation on mental health among our faculty, staff, and students. People no longer see a police officer or a police dog. They see someone holding a leash, willing to listen, with the help of their furry friend who loves belly rubs and jerky treats. During some of our visits, individuals have felt comfortable enough to talk about their experiences, and at times have talked about incidents that may be concerning of them, and whether or not to report it. It's these small changes. In last September, Brady and I left our jurisdiction and found ourselves in Maui, as we were assisting the victims of the Lahaina fires. And for 2 weeks, I could see the impact that one animal had on an entire community. As we're walking into the recovery center, I hear, "Oh, puppy." And I see a mother and child walking to their car with basic items to get them through the rest of the week. We stop and we talk with them. The young child has a beautiful smile on her face, just petting Brady and getting time with him. And before we left, I told her, whenever you're scared or whenever you're lonely, just hold on to baby Brady. As we go into the Civic Center, the staff points over kind of to my left. "You need to go over there. We need you over there." I had no idea where I was going, but Brady did. He walked straight up to an individual, stood next to him, and rested his head on his leg, all while this gentleman was talking about his experiences and crying and letting out his emotions and the losses that he had. If only for a moment, Brady allowed a community to breathe and to give them some peace in their tragedy. We need more. By adding additional resources, facilities, counselors, and yes, even therapy dogs. So much so our department here at the university is considering adding a second therapy dog, because one animal can change the lives in the midst of a tragedy or crisis. You know, last semester we had a slogan. It was "Take Back Texas." Texas State is leading the way in terms of mental health resources and wellness. We're paving the road to add more, and we are listening. And how do I know this? It's because I've had other departments, not only in the state of Texas, like Texas Department of Public Safety or Hardin County. I've had Hawaii, and I've had the University of Missouri reach out to us about our program. I attended a mental health conference and heard a gentleman speak in the aftermath of the riots of January 6th. After his presentation and everything he's said, I went up to him and said, "What is holding you back from getting your therapy dog?" And before I left that conference, I gave him all of our information and all of the research we'd done. What does self-care look like? What can we do today? You can take 30 minutes out of your day and do something you enjoy. And that could be anything. It could be a massage, a puzzle, coloring, painting, journaling, reading a book, or even requesting Brady. That's right, you can request Brady. He has his own email. It's not just about, it's about everyone. These are photos of where Brady and I did our own self-care while we were in Lahaina. We took 30 minutes out of our day to have some water therapy. Something I want you to take away from this. Remember that you are not alone. There are resources out there, and if you need to find some, reach out to me. We are listening. There is help, and there is hope. Let's be the difference. Come on, buddy. Come on. I love you, Brady.